Garg is joining us here on the broadcast. Thank you very much, Dr. Garg, for speaking to us. The fact here is that the fourth case perhaps sounds a little more concerning because this person from Delhi had no history of travel, and that is the reason. But what is your perspective?
See, what I like to say is that on Saturday, WHO declared this monkeypox as a public health emergency of international concern. Till so far, we have got 60,000 cases from around 75 countries, and most of the cases have acquired infection through sexual route. So that is one thing which is also very important to be considered also. So, we cannot deny the fact that monkeypox is not there in India. Not for the first time we are getting the cases. So we have to involve all the necessary monkeypox vaccine in around 80s. So that's where we need to manufacture of the vaccine. And I as president of OMAG, which is a combination of 15 professional associations, I was president in 21, and we gave it in writing that the government needs to be very vigilant about monkeypox, because it is not only skin to skin transmission or face to face transmission. The transmission can also occur through sexual route, because the cases what we got from Europe and all, they were getting infection through sexual route also. The need is to be for NCDC and all the important agencies to be very vigilant, but at the same time we need to put in place our preventive measures involving all the important stakeholders. So that is where it is very, very important that we keep a watch on the situation. We need to look at the behavioral part of the individuals. We need to also look at from the vaccination perspective.
Right. And what more can you tell us with regard to the vaccination perspective, and also what is the treatment for somebody who contracts monkeypox?
As of now, these are the antiretroviral which play a little role. And most important is the preventive part. As I told you, that basically we had earlier smallpox vaccination, which we stopped giving in 80. That is there. But then, we need to kind of rethink about, bringing the vaccine. So that is the virus mimics like that of, the smallpox belongs to the same family. The lesions are little milder. They don't leave much of scar. But then as you initially look at, initially they mimic like chicken pox, but then some of the lesions are more pustular. That means they are pus forming lesions are there. So it is important that we need to look from that perspective also, that we have to look at, the vaccination part, because that vaccine will be effective, with monkeypox also.
Right, and the way we're seeing it spread in some of the other countries, what is the concern with regard to India now, obviously going forward, given the spread that we are seeing elsewhere?
See, now we talk of one world, one health. So it is not that the cases what we see in our neighboring countries or in Europe and all, they will not be seen in India, because you will see that the 3 cases had history of travel, but the 4th case never had the history of travel. The viruses, these are all viruses which are teaching us new things every day. And we are having lot of learnings also. Because the cases of smallpox, we saw much before. As I'm talking of, when I talk of 80s, and about 40 years back we are talking of these cases, and since 1970 we were seeing the cases of monkeypox in human beings earlier, and that too in African region and all. So but then the new viruses are going to teach us a lot of lessons in terms of the prevention part, which is very important from public health perspective, but then behavioral part. So this virus this time has taught us that sexual route transmission is very, very important role which is played in 98% of the cases. It was seen in out of 16,000 individuals. It has been seen in bisexual individuals or people who had visited the multi-partner sex workers also. So we need to involve National AIDS Control Organization as well. From this perspective, behavioral change interventions will play, having a responsible behavior will play important role. But then we cannot keep our hands tight, because it's also transmissibility rate is around 2.5. So that's where we need to keep a watch on the whole situation, and then we need to kind of rethink about the vaccination which is there in the laboratories, but the government has to take a call along with NTG that basically this vaccine has to be, kind of given as a preventive measure to other individuals as well.
Right. One final question, Dr. Garg. So far from what we know with regard to, how monkeypox sort of progresses, symptoms, etc., from other countries, what can you tell us in terms of, the kind of extent of severity? When is hospitalization needed? What is the kind of, obviously, like you said, no real treatment as such, but what kind of medication is taken in such cases?
See, it is basically, as I said, initially the symptoms are same, like fever, cough, coryza, and then subsequently after a few days, the lesions, they start appearing, and we all have seen the earlier pictures of, having pustules in the limbs and all that, and that's where, but more important is that, it, uh, we have to be quite worried about the scar part, which we have not seen much, in the cases, but then, it also leads to a lot of stigma and discrimination also amongst those individuals who are presenting like this. But then, the mortality is lesser than that of smallpox. Like in smallpox, we had almost 30% mortality. But overall estimates tell us about mortality to the tune of 10% in severe cases. So we have to be watchful, early identification, hospitalization, isolation, and contact tracing. These are some of the important pillars which also played a critical role in terms of COVID also, where our principles of containment of pandemic remain the same. So now this is a public health emergency of international concern. We have to be very vigilant about it.
Absolutely, Dr. Garg. Thank you so much for joining us with your perspective and with all of that important advice.
Thank you.
Moving on, a huge explosion took place in Bihar Saran area in which 3 people have died and many injured. The explosion took place in an illegal factory, being run from a house. 4 people are hospitalized and rescue operations are underway.